Craig Stout here with Professor Medicare. Let's look at Medicare supplements. This concerns question number 4 in our Map to Medicare series. Here again are the 4 questions. Number 1, when do I enroll in Medicare A and B? Number 2, do I stay with original Medicare A and B, and what's the cost? Number 3, do I choose a Medicare Advantage plan? What's the cost? And number 4, do I choose a Medicare supplement, and what's the cost? Once you enroll in Parts A and B and have decided to forego staying with just original Medicare, you're at the point where the rubber meets the road. Do you choose a Medicare Advantage or a Medicare supplement or Medigap plan? We just covered Advantage plans in the last video. Let's check out supplements. They work in conjunction with original Medicare A and B. I'm going to abbreviate the name and just call them SUPs. The plans are offered by private insurance companies and they pay for medical expenses not covered by Parts A and B, including some deductibles, copays, and coinsurance charges. Here is how they work. Here's how a normal office visit works with a SUP. Let's assume you have a Plan G. G has a $203 yearly deductible. You see the dermatologist of your choice and show your Medicare and SUP cards. Medicare pays 80% of the agreed upon fee for services, leaving 20% for you to pay. But after paying your $203 yearly Part B deductible, your SUP picks up this 20%, covering the gap between what Medicare pays and the full service charge. You have eliminated copays and coinsurance. If you have a Plan F, there is no yearly deductible. This differs from how an MA plan works. With an MA plan, you would go to a dermatologist in your network and have a copay from $0 to $50 in most cases. Or, let's say you had outpatient surgery with an MAPD. You'd pay the fixed rate of anywhere between $140 and $325 for the surgery. With a SUP, you pay $0. A wide variety of private insurance companies offer SUPs. In our Colorado zip code 80301, more than 40 companies will offer plans A, B, D, F, and G, high deductible F and G, K, L, M, N, and N for 2020. Actually, 2021. Alphabet soup. Through a collaboration between the Center for Medicare Services and the National Association of Insurance Commissioners, each state approves a slate of SUPs whose healthcare benefits are identical. Plans with the same letter offer the same basic benefits, regardless of the carrier. That means all Plan Gs are the same no matter who you buy them from. A G is a G. The only variable is the premium an insurance carrier charges. Some plans offer discounts that can lower the premium. Others offer services beyond the basic required coverage. For example, a few plans offer Silver Sneakers fitness programs as an added benefit. Any provider who accepts Medicare A and B will accept your SUP, and you can use any provider in the U.S. who accepts Medicare. No referral is needed to see a specialist. Supplements do have monthly premiums, and they vary from plan to plan. You'll see yearly increases, usually in the 3 to 4% range as you get older, and occasionally all plans have a general rate increase. Let's compare a SUP to a Medicare Advantage plan. First, we'll look at a few benefits and then premium costs. Take a look at this representative chart that will give you a good glimpse at some of the differences between a Plan G supplement and Medicare Advantage. Now, there are many more line items, but we don't need to show everything in the video. I want you to look at this: the premiums, the deductibles, the specialist visit, a hospital stay, outpatient surgery, testing, max out-of-pocket, and referrals. When you're choosing a plan and look at your health, you can only base it on your history to date. Your future health is an open question. Now, let's look at a typical cost for a 65-year-old female in our zip code 80301. With both, she would pay Medicare's Part B premium. With the supplement, she has a monthly premium and a Part D plan. That makes 3 premiums if choosing a supplement. You can see that the yearly costs for a supplement are almost double what they are for a Medicare Advantage. However, we have not included Medicare Advantage copays or coinsurance, and that's a big variable. These are simply the basic costs. Any services within the Medicare Advantage plan would be added to that $1,782 number. Later, we'll look at a few supplement plans and compare them. But I will say that our most popular plans are G and N. F used to be the most popular plan, but as of January 2020, it can't be sold to anyone turning 65 or whose Medicare became active in 2020. Plan F took care of the Part B deductible, and now Medicare wants everyone to pay that deductible. We just showed you the major differences between SUPs and Advantage plans. Here's a scenario you need to be aware of, and it has to do with changing plans. For example, when you turned 65 and became eligible for Part A, you enrolled in a Medicare Advantage plan. It became active on your birth month, 1st of September. But 6 months after the plan began, you discovered you didn't like the Medicare Advantage plan, or that a new and possibly very expensive health condition arose, and you want to enroll in a supplement. The good news is that during that first year, you can move to a supplement with no health questions to answer, no medical underwriting. It's a grace period given by Medicare, but it's only good for that first year. So what if you want to change from Medicare Advantage to a supplement plan, but it's 2 years after you enrolled? You will have health questions. You can be denied or charged more than the standard premium, depending on how you answer the questions. Moving from a supplement to Medicare Advantage much easier. You can do that during annual enrollment, October 15th through December 7th. There are no health questions for Medicare Advantage. You cannot be denied coverage. The other thing to be aware of is that SUPs do not include Part D drug plans, so you need to enroll in a standalone drug plan. Most Medicare Advantage plans include drug coverage. SUPs do not include dental, vision, and hearing benefits, and a few do include fitness memberships, but only a few. Here are some of the questions we ask clients who are deciding between SUPs and Advantage plans. Have you been dealing with a network in your current plan, and how was that for you? Do you go out of state for extended periods of time? Would you say your level of usage in your current plan is low, moderate, or high? Is getting referrals okay with you? Do you want dental, vision, and hearing benefits in your plan? Now that you've seen the premium cost, what do you think? Depending on how you answer those questions, we can get a good idea of what you will choose for coverage. Now, this video concludes our journey into the 4 questions. Now, we'll be looking at specific areas within Medicare coverage. Next is Part D, drug coverage. If you like this video, please subscribe to our channel, as we'll be adding videos throughout the year. Also, here's our contact information. Feel free to call, go to our website, request a free consultation. Bye for now.